Hello, everyone. It's Thursday, May the 20th, and again, good news, but still always tough news and bad news. But we've had 7 deaths since Monday, and our total death toll now is 2,769. I ask you over and over and over to make sure that these people don't just become a number. The 2,763rd death is an 87-year-old female from Jefferson County. The 2,764th death, a 60-year-old male from Berkeley County. The 2,765th death, a 36-year-old male from Webster County. Our 2,766th death, a 72-year-old male from Kanawha County. Our 2,767th death, a 67-year-old female from Raleigh County. Our 2,768th death, a 49-year-old female from Kanawha County. And our 2,769th death in West Virginia is a 71-year-old male from Mercer County. The numbers are 301 new positive cases. The positivity daily rate is at 4.27%. Our cumulatives stayed the same at 5.12. Our active cases are down significantly. They're 5,892, and our recovered cases are 150,789 West Virginians have recovered from this dreaded killer. We have 221 patients hospitalized in West Virginia and 80 patients in the ICU units. And now we have still one county, but now it's Nicholas County. Hampshire County has come out of the red, but Nicholas County's in. I remind you all the time, if you're 65 years and older, if you have any kind of symptom at all, you should get tested immediately, and our antibodies could very well save your life. Vaccines are now, available to all West Virginians 12 years of age and older, and the vaccines are free, and we surely encourage people to get your vaccination. Please do. From the standpoint of our 12 to 15-year-olds, we have 15 county school systems that are scheduled to hold clinics this week, and all these clinics will offer vaccines to all eligible West Virginians, including other students, parents, and educators, or whomever would show up. We'll vaccinate anyone if they come to these clinics. We have a total of 78,000 12 to 15-year-olds in West Virginia, and we want to get a great big percentage of them, vaccinated. Our young people that are 16 to 35, I am again calling upon all West Virginians to help us with those people, to help us to get those people across the finish line and get the numbers of them vaccinated really high, because we need that. We found that they are real transmitters of this tremendous disease, and we got to have their help and get them vaccinated. Our savings bonds and gift cards. Now, this one is really important too, but today we are opening registration for our savings bond / gift card program. All West Virginians ages 16 to 35 years of age that chose to get a vaccine will have a choice of either a $100 savings bond or a $100 gift card. These will be retroactive, meaning that all West Virginians that have gotten the shots and gotten the vaccine that are aged 65 to 35, will also receive this savings bond or gift card at their choosing. To get the savings bond or the gift card, go to my website. It's right there, and it's governor.wv.gov. You see it right there? Please, please, please go right there. We'll send you something really nice. We'll send you a $100 savings bond, or we'll be sending you the gift card, $100 gift card, and everything. We really appreciate you getting vaccinated. Not only are you picking up a few extra bucks here, but you may very well have saved your life or saved others, and we're going to continue with this program. And absolutely, we want all the 16 to 35-year-olds to get vaccinated. We need you to get vaccinated right now. Okay, our vaccine distribution update, we're 83.3% for first and second doses so far this week and everything. Our goal is always 100%. We're at 72.8%, fully vaccinated of the people that are 65 years of age and older. We're at on our total population, we are now 45.5% fully vaccinated, and we know it kind of dropped down. And the reason it dropped down was because we added the 12 to 15-year-olds, and we're at 55% that have received one dose. Our Saving Our Wisdom, program where we're working really hard to try to get to 85% of our 65-year-olds. We're at 81.9%. That's fabulous and everything. So we're really doing great right there. On our 50 to 65-year-olds, our goal is 75% there. And if you are 65 years old and you're still waiting for a vaccine, please call us. We'll get it to you immediately and everything. And the other thing is, our goal is to get to 65% of our total eligible population. This is a nice announcement too. Today I am announcing that we are ready for the full reopening of all our West Virginia senior centers. The Bureau of Senior Services will be issuing safety guidelines later today. We want them to follow all the guidelines and do so safely, naturally. Anyone who has not been fully vaccinated will still be required to wear a mask or face covering inside the centers. See, it's even more motivation, more and more and more. I'm going to read this last line again. Anyone who has not been fully vaccinated, is still going to have to put up with that crazy mask and a terrible mask that really probably saved lots of our lives. But anyone who is not fully vaccinated will still be required to wear a face covering inside the centers. If you're a business, manufacturing business, any type of church, we absolutely are pleading with you to call us. We'll come to you and do your employees. We'll come and do your congregation, and we'll come immediately if you'll just call. From the standpoint of our state parks, we've got ongoing vaccinations there all over the place, and we're going to be at all state parks, state forests, and we'll be offering vaccines over the Memorial Day weekend to all the employees, the employee families, the park guests, anyone that comes. And we're doing this throughout the state at all of our state parks, but we will be everywhere on Memorial Day over that weekend. All the details are posted at wvstateparks.com. The CDC mask guidance, and everything, they came out, they announced last Friday, and we're now following that updated CDC. Anyone who is fully vaccinated can participate in indoor or outdoor activities without wearing a mask or physically distancing, regardless of the crowd size. And that's great. That's great news. Our face covering requirement no longer applies to you if you're fully vaccinated. This policy is based on an honor system, so I encourage all West Virginians to get their vaccine so that they can no longer have to wear a mask. Our face covering requirement will still apply for all those that have not been vaccinated until June the 20th. And June the 20th, our target date and everything is to get rid of the mask once and for all. Remember, though, that any private business, they have a right to require you to wear a mask in their businesses and everything, so don't push back on that hard. I mean, they have a right to do that. This is their business. They're going to decide that. From the standpoint of our Call to Arms initiative, our mask mandate will be lifted on the state's birthday, June the 20th. By that time, using the incentives that we have in place for our 16 to 35-year-olds, and with the expectation that the CDC will allow the vaccine for those that are 12 to 15 years of age, and they're doing so, we expect we can get to these numbers. We can get to 65% of our 12 and older, and we can get to 75% of our 50 and older, and we can get to 85% of our 65 and older. So with the CDC giving us that go, you know, we've got some more work to do because we've got 78,000 that was just added to our eligible folks, and we got to get their number way up, and we got to get it way up quickly and everything. So 12 to 15s, we need y'all to step up right now and talk to your parents. We need a guardian signature and everything to get you that shot, but I think that's going well, and maybe we can talk a little bit, with our experts, about that in just a few minutes. From a standpoint of getting tested, it's still all free. I encourage you in every way. All of our information is up on my website. Again, we thank Walgreens, we thank Frith for all they've done. They've been fabulous beyond belief. Our long-term care facilities, we have 16 outbreaks there. We have 7 in our churches in 4 counties. That's Greenbrier, Hardy, Nicholas, and Wetzel counties. We got to tighten that up just a little bit too. We were really fabulous there, and we've lost a little bit of our momentum there. We're down to 4 inmate cases and 3 staff cases. It's phenomenal. Absolutely, corrections, what a job, all through everything that they've done. And I tell you all the time about giving blood and giving, plasma, that saves lives. And if you have had the blessing from God above and everything, and you've gotten through this and everything, I really, really, really ask you to consider giving blood. From a standpoint of the unemployment benefits and everything, last Friday I announced that we will end all federally funded pandemic unemployment compensation programs in West Virginia effective June the 19th at midnight. West Virginians have access to thousands of jobs right now, and we need everyone back to work. We're a work society. That's what founded this country. We got to get you back to work. Our small businesses and economy absolutely depend on it. This will also include the additional $300 weekly payment as well as the benefits for the self-employed. Any weeks filed before June the 19th that are eligible under the federal program requirements will continue to be processed. Workforce West Virginia stands ready to help West Virginians return to the workforce. Okay, your bonus payments and everything, we're still working on that with businesses and everything, and seeing how many dollars that we have that we can put towards this and everything in West Virginia. We do not have that finalized yet. We were talking about maybe doing a match between a business doing $500 and us do $500 at the state level, give people $1,000 to incentivize them to get them back to work. That's great. But that, to me, is laying too much of a burden on our small businesses, and we're working that. We don't have that finalized yet. Here's a good deal. Our April unemployment numbers, I'm sure you know by now, came in at 5.8%. The national average is 6.1%. West Virginia is still kicking butt there and doing really good. The number of unemployed state residents decreased by 1,500. But there's still unemployed 45,800 people in West Virginia. The total employment was up by 1,700 in the month, and all that's good, but we still got a ways to go there. We still got a lot of folks that we can get back to work. This is a neat thing, our road bond sale. On Tuesday, the state of West Virginia sold the last $200 million of the general obligation state road bonds. And generated, get this, we generated on that $200 million of sale, $262.5 million. Now, we have a premium. We get extra money. We have a premium of $62.5 million, that we can use for new highway bridges or new highways, secondary road, construction projects. We can use it for anything. The premium rate was achieved in this sale marks the highest premium rate of any of the state's road bond packages to date. Now think about that. Now the thing that I'm the most proud of is just this. I've told you over and over I'm a business guy. I'm not a politician, but I'm a business guy. And really, a lot of my advisors came to me and said, Governor, because interest rates have risen a little bit, and because with all the uncertainty that's out there about West Virginia and what West Virginia's doing, we even had a level of uncertainty about, the personal income tax, tackling the personal income tax. And so, Governor, with all that, we think we would be best suited on this last $200 million if we went to a private sale. In other words, we weren't exposed. We went to a marketplace to where we could basically dictate what would happen. And in doing so, we would not be exposed. But naturally, you wouldn't get the best deal. You wouldn't get any kind of great deal because, you would have gone into an area that would have been super, super conservative because you're afraid. You're afraid really of what Wall Street and what the world thinks about West Virginia. And that's what we got. Say it or not, and believe it or not, really, whether it be Prague or whatever it may be, we had folks that were vapor locked because they were worried about how the market would perceive West Virginia. Now, there are points in time when I've got to be the governor, don't I? And there's points in times when I've got to be the boss, and I've got to make the toughest decisions. And in this situation, I'm going to tell you just straight up, the decision was easy for me. You see, I believe in West Virginia, and I truly believe the world is beginning to really believe in West Virginia. So I said, no way. We're going to the market. We're going right to the market. We're going to take the risk, and we're going right to the market. And we did so. And boom, we got the highest return ever. We got these bonds, I think, at 2.55% interest rate, which was the lowest we've gotten, significantly the lowest we've gotten. We got the biggest premium per dollars that we went into the marketplace for because we believed in West Virginia. We believed in you. That's what we did. That's the decision I had to make because I know just how good you are. And I know how this state is really moving. So I congratulate everyone. I'm tickled to death we went to the market, and I still believe in this great state in every way, and the market reflects just that. They believe in us too. And when you're hearing that all across the land, I mean, come on, let's go. We don't need to walk around with our head down anymore. We need to walk around with our head up and happy about who we are. And so I loved it. I loved it when the market just stepped up and showed all of us, just how good we really are. I knew it would happen. And lo and behold, boom, it happens and everything. We got $62.5 million extra money. Absolutely, we have got the best bond success in this whole Road to Prosperity program that you could possibly have. I mean, good stuff. Now, I've got two other things. I'm going to save this one to the last. We got everybody in the world's birthday today, but General Hoyer's birthday today. He's 118 years old now, and I don't know why he's hanging on, but he just keeps hanging around, and we keep putting up with him. But nevertheless, I hope he's got his sweater vest on today, but I haven't seen him yet and everything, but no, he doesn't. He looks all spiffy and everything. I mean, for 118, look at that face. But also, I guess Jordan's birthday's today, and Ann Erling's birthday, and Mary Lippert it's her birthday today. Like I said, I don't know, I may miss somebody, but nevertheless, all of you, happy birthday. And the last thing I have is just this. On last month, it was Monday night and everything. It was Monday night Marshall played and everything. Is that correct? Because it's all running together. And And a lot of people said, well, are you going to go? And I said, listen here, it would take, as Tom Floyd in South Carolina used to say, it would take a bulldozer. And he called them bulldozers. It'd take a bulldozer to keep me away. Well, the long and the short of it is I was able to go. Kathy was able to go. We were sitting right in front of Marshall's goal, and in the second half, and there you see a picture of Kathy and I, from the back and everything, and in the celebration that was going on that happened right in front of us with 2 minutes and I think 52 seconds or whatever left to go in the first overtime period. The teams played really, really hard and everything. Marshall had already climbed a mountain like you can't imagine. They'd beaten Georgetown, the defending champions. They had beaten the #1 team in the nation, Clemson, and they had beaten North Carolina. And now here they are in the finals against Indiana, the second-ranked team. And absolutely the game, just went back and forth, back and forth. There was a couple of attempts on goal at the Marshall end in the first half. One of them hit the goal post and everything, from Indiana, and all of a sudden now we're in overtime, 3 minutes to go, then under 3 minutes to go, and then all of a sudden Marshall's got a chance to score, and then lo and behold, boom, it just happens, and it happens so fast, it's unbelievable. And then the celebration begins because you've got the national champions in West Virginia. And after the game, I was being interviewed by Amanda Barron and Tim, and they were asking me my feelings about it, and I even right now could get choked up about this because I saw all the phenomenal successes with Coach Pruitt at Marshall and everything. But, I tell you that to this day, a moment that you just can never get over and never forget. I was in the dorm, Kathy in another dorm, when the plane went down. And a lot of really good friends. Keith Morehouse was speaking to Amanda and Tim on the air when I walked up and everything, and Keith Morehouse's dad was on that plane, a great friend of our entire family, Gene Morehouse, and it was really good, really good, and so I can't be more congratulatory. I loved it to death. Any success that comes and puts the spotlight on West Virginia is so good, and so we're all proud. Every one of us is proud, and maybe I was a little wrong on the timing on the kick that went in. I think it was a minute and 50 seconds or something like that. But what a night and everything, and it was really good. It was just a real honor for me to be able to be there and representing West Virginia, and my goodness, I was one proud puppy. That's all there is to it. So anyway, that's all I got right now.
All right, thank you, Governor. Let's first today go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
As the Governor pointed out, we continue to make really strong progress, particularly 50 and above. We will have a number of additional opportunities for folks going forward, to include continuing to work with primary care providers. As he pointed out, there are a number of vaccine clinics this week for our 12 to 16 and 12 to 18-year-olds with our school systems, and we appreciate the work of the Department of Education, our county school boards, and our school principals. We continue to need West Virginians to press forward. Dr. Marsh and I participated with AARP today on a town hall, and I hope that will generate some more opportunities. And finally, Governor, I appreciate the birthday wish, but my wife just sent me a text and said she's going to have Kathy put you in the doghouse if you keep picking on my fashion sense. So I just want to give you fair warning.
Okay, okay, good enough. Listen, I mean, anybody could dog me all day long about my fashion stuff. That'd be good with me.
All right, thank you, sir. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to share the governor's well wishes and congratulations to General Hoyer and to Jordan and to the others for very happy birthday wishes and great health and happiness and success. And I also joined the governor to congratulate Coach Grassi, the Marshall men's soccer team, President Gilbert and all the Marshall family. That was an amazing game, and the team played exceptionally. I thought much better than Indiana University, that is a perennial national powerhouse. So really kudos, fantastic. On the COVID-19 front, I think that, again, we see continued good news. We are seeing the cases continue to decline in West Virginia. We still see the major amount of spread among our younger West Virginia residents. The median age has now dropped to 33 years old, and it was 34 years old the last time we reported. And as the CDC really indicated in their changing of guidance, that there are 4 basic studies that inform their decision to relieve the mask mandate for indoors and outdoors for people fully vaccinated and 2 weeks after vaccination, and basically looking at groups of healthy volunteer healthcare workers that were immunized and looking at the benefit of the vaccines. They found that these vaccines were 90% or so effective in reducing infections and 97% effective in reducing hospitalizations. Looking at an older group of patients, 65 and over, these vaccines were equally as effective at reducing infections and also reducing risk of hospitalizations or death. And then looking at a group of people who are in Qatar, a country where half of the cases of COVID-19 are generated by the United Kingdom variant and half by the South African variant. They found, again, these vaccines were very effective at not only reducing infections, but even more effective at reducing hospitalization, severe illness, or death. And these are real world studies. So basically the overwhelming evidence now says that these vaccines are really unbelievably effective. And looking at safety data in over 250 million vaccines given in the US and over 1.3 billion vaccines given across the world, we find that these vaccines are incredibly safe as well. The biggest impact of any kind of effect is 24 hours or so after the last dose of vaccination, where people might feel a little not great, a little virally, and that's not a virus infection. That's really just your immune system getting ramped up. And also we know in a very, very small group of people who received the Johnson & Johnson vaccine or the AstraZeneca vaccine, usually women under 50 years old, then there may be a slight risk of blood clotting, but this is a super rare event, about 1 in a million people getting the vaccinations. So these vaccines have really been shown to be unbelievably safe and unbelievably effective as well. So that's a reason why for all West Virginians, we encourage wholeheartedly, based on medical data, scientific data, and also based on our love for each other and our wanting each West Virginian to be safe, to have a full and happy life, and also for our young West Virginians to avoid any potential of developing long-term effects of COVID infection called long COVID. And the best way to prevent all those are to be fully vaccinated. And we hope that as we continue to see West Virginia open back up again and return to all the things that we love, that each citizen will take that run to the fire and pull the rope in the same direction adage that the governor has given us over and over again to make West Virginia the model for the rest of the country. So thank you.
Thank you, Dr. Marsh. Next to Dr. Ainam Jad, our State Health Officer.
Good afternoon. I also want to wish General Hoyer and Jordan a happy birthday and hope they have a nice day today with their families. The variants of concern in West Virginia are still something that we're watching. The total number of variants so far are 1,745. The UK variant, we are at 1,498 in 51 counties. The top counties are Berkeley, Mon, Jefferson, Raleigh, and Kanawha counties. The California variant, we're at 234. Right now, the South African variant is at we have 5 cases, and the Brazilian variant are in 8 cases. So it is present here in West Virginia. We are doing well compared to other states. However, it does bring to the importance of vaccination, as Clay did mention earlier. So we do want to remind everyone that those are still available, as well as our testing sites across the state. So those are still free and available on our website on the DHHR site. Thanks, Jordan.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Bob Aaron with WCHS and Fox 11.
Yes, I'd like to clear up a little bit something about some of the numbers. I believe, if I wrote it down correctly, the governor said when it came to one shot out of the eligible population, we were at 45.5. I think the dashboard this morning, which I guess includes the entire state, said 47.8. I'm kind of confused by those numbers, but looking at them, it doesn't look like we're going to get to 65% by June 20th. And when it comes to the general population, it doesn't look like we might ever get to it, really. I would think that it would slow down as the weeks go by. We might see a spike this week as we're doing a lot of 12 to 15-year-old clinics. But are we going to make it? And what's the consequences if we don't?
Okay. Bob, the numbers that I have, and remember, we're trying to get to 65% that have one dose, that have received their first dose. Now, and the numbers that I have, we are at 45.5% fully vaccinated, but that's not the number we should be dialed into at all. We're at 55% that have received at least one dose. And that number got pulled down a little bit because when we brought in 78,000 that hadn't had any doses, 12 to 15-year-olds, it's going to take a little while for us to catch up on that. But that number is at 55% right now. We're going to be really close to the 65 on June the 20th if we keep on moving the way we're going. And General Hoyer's got a lot more of the details, but General, if you could go, please.
Yes, sir, Governor. So, Bob, as the governor pointed out, our 3 benchmarks are 65% of the eligible age population, 75% of the over 50 population, and 85% of the over 65 and above. So we are well on target path to the 50 and above and the 65 and above, and we continue to work a variety of different opportunities with different types of clinics, as well as continuing education and advertising for the eligible age population, which is now 12 and above. So we still believe that we are on a path to get to that 65% on June 20th, or close to that 65%. It's still going to take a lot of work, but we still believe that we are on the right trajectory based on the data analytics that we do every day and the work that the team does to model that.
All right, thank you, Bob. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to ask about the savings bond gift card incentive. So you said the registration is open. Do we have an idea of the timeline for when people will start receiving the money? And when you say, when we say receive, are these going to be sent out via the mail, or is this some kind of electronic transfer? And now that we have all the details done, do we have an overall price tag? I know you've given us an estimate before. Is that the same now that we've gotten it all locked down? Thank you.
Okay, Charles, I'll give it my best shot and everything, but you know, we have an electronic registration, you know, to request the savings bond. We have already received, you know, we have already got in the system. We're beginning to process and everything the gift cards, and they should be going out very, very soon. From the standpoint of you know, the numbers and what it will be, what the total cost will be, I still project the total cost is going to fall somewhere around $20 million. You know, but I think we've still got a ways to go. You know, the last check that I think we're somewhere now. Don't hold me exactly to this, but we can get you that number and get you a better number. But I think we're probably right now at the level of total vaccines given to our 16 to 35 years of age, probably somewhere around 130,000. And if we're around 130,000, that's 13 million that's going out the door. And the other thing it'll do, it's dollars that will go out the door and stimulate our economy some. It's a great keepsake and all that from the standpoint of our savings bonds. People that get in the gift card and everything, you know, are absolutely going to be spending those dollars, and that'll help us in our economy and our small businesses. So I think those numbers are close. Don't hold me to that 130,000. I think we're really close on that, but we're going to keep on, you know, getting them vaccinated.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, everyone. Happy birthday, General Hoyer, who's now 2 years younger than me, and Jordan, who's probably half my age. Of course, the governor and I both had birthdays in the last week, too. So a lot of good Taurus people born in the month of May. My question, and maybe the doctors want to handle this, because I see the breakdown in the variants on the website, but it breaks it down by race and by gender. It does not break it down by age. And I know the younger people are the most vulnerable. So can you give us a general ballpark sense of who is getting the variants and what you're doing to really get the word out that these folks need to, they really need to get vaccinated because they're most vulnerable to the variants?
Okay, Dr. Marsh and Dr. Amjad, this is for you guys, please.
Do you want me to start or you want to go first? Okay, so thank you, Mark. We know that the majority, the biggest group to spread the variants is in our 20 to 29-year-old age group. And if we look at the most common age group to spread the virus in general, is our 10 to 19-year-old age group. So that 10 to 29-year-old age group is really the group that we are most focused on to try to reduce the transmission. And remember that the virus can only replicate when it is infecting somebody. So the virus cannot continue to mutate, to make genetic mistakes as it replicates, because it's a messy virus. It doesn't do things really precisely. And as those genetic changes, as the virus replicates, add up and gives the virus a beneficial effect at having an easier time infecting people or being able to evade the immune system better, then that virus becomes a variant. So we are very, very concerned about the potential that not only in West Virginia, but around the country and the world, that the more unvaccinated people we have, the more they act as reservoirs for the virus to continue to mutate and to introduce new variants. And so in West Virginia, we are really hoping that not only because of protecting the spread of new variants in the state, but also the risk now of the existing variants, particularly the United Kingdom variant, which infects young people much more avidly and can cause real problems long term, that young people are deciding and families are deciding for their young people to get vaccinated, to choose vaccination, which not only reduces that risk of spread of the variants and new variants coming to West Virginia, but also protects each person.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Happy birthday, General. Happy birthday, Jordan. I wanted to veer off of COVID-19 for a second to see if I could get an update on the Hyperloop project. I understand when the general relocated that was going to be part of his mission in military retirement anyhow. Governor, General, could you give us an update? I hear things are going pretty well.
I think, General Hoyer, you can do this better than anybody. Yes, sir.
Yes, sir, Governor. And as you know, Paul, we continue to make progress with the Hyperloop team. There are a number of initiatives going forward about the possibility of how that might play in infrastructure development as it's discussed within the Congress. We are working with the landowners on the work that needs to be done related to the site for the center, as well as the test track going forward. So progress continues to move forward. Hyperloop is still strongly committed to its West Virginia efforts going forward, and I think probably within the next couple of months we'll see more activity moving forward.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Happy birthday, everyone. On the unemployment issue, expanded unemployment. Governor, you've talked about two groups of people. You've said, I'm not talking to someone who is out there really struggling, really trying to get back to work. But you've also said, I am talking to the people out there who have decided to be able to take the bonuses from the federal government and to just ride along. And what I wonder is, when you talk about West Virginians, how can you determine how many people are in each group? Wouldn't the policy apply to all? Thank you.
Brad, the policy's got to apply to all. And you know, and all I can say is just this. That's why we're trying to work on a bonus program and everything that we'll be coming out with as soon as we get the wrinkles out of all the thing and everything, to where we can, you'll have to reward all again, but absolutely, the most concern I always have is someone that's genuinely really trying. You know, the problem, you know, with any, you know, I can remember a long time ago, you know, I was at the National Corn Growers Convention, and they just come out with a new farm program. And the guy that was at that time head of the USDA was presenting the new farm program. Now, the National Corn Growers Association doesn't sound like much in West Virginia, but it is a gigantic organization. I mean, a gigantic organization. Now, and all that, we were there, and I can't recall, you know, if it was in Kansas City or wherever it was, a long time ago. And the head of the USDA stood up and said, well, today we announced, you know, our national program, our national farm package and everything. And we know that there'll be some that will be out even tonight trying to game the program, you know. Now, that's what we know is happening with some. Well, that's not good. We need those people back to work. You know, the problem is you've got still people that are really trying, that we want to still extend a helping hand to in every way. And that's where it gets dicey, and that's where it gets difficult. And that's why we're trying to come up with a bonus program if we can. And on top of all that, we absolutely have job opportunities for everybody. And we have people that are calling us nonstop, whether it be construction or trucking or whatever it may be, you know, from restaurants and all of our small businesses all across the land. They can't get people. And if they can't get people, their business can't function, and they can't function properly. So we've got to find a way to get our folks that are in West Virginia back to work. So that's the whole problem and the whole deal. And so, Brad, the wages are good about people going back to work, and we've got real live competition for workers today. And when competition exists in this great country, you know, then wages move up and all kinds of good things start to happen, because that's our foundation of this country. That competition is what drives us. And so, you know, I hope and pray that those people will go back to work and get a better job, get a good job, and and help the small businesses, and help their families, and help themselves.
All right, thanks, Brad. Next to Mark Cram with WDVM.
Good afternoon, everyone. Going back to the resumption of the Johnson & Johnson vaccine, I'm wondering how that's being received. And if you could also please confirm that individuals have the option of choosing which vaccine they prefer. Quite a change from when this all started, and it was basically take whatever's there and move on. But we're in an obviously much better place now. So how is the Johnson & Johnson distribution going? Do you still find some individuals hesitant to use it?
Dr. Amjad, this is you.
Sure, Mark. To answer some of your questions, it is still an option as long as the facility has it, but you can request, which one you do prefer to answer that question. We do still have a lot of people asking for the Johnson & Johnson because it is, one shot and done. So I don't think, we do believe that people who did not want the vaccine before, that deterrent was still there when it was paused on the Johnson & Johnson, because we are still seeing people request it at various locations. So we have not noticed any difference in that. So because it is one shot and then, the 2 weeks afterwards, you're having some protection. So we haven't seen that, but you can request it and see which one you want. We have plenty of vaccines available in all locations right now. Thanks.
All right, thanks, Mark. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I wanted to follow up on Brad's question about the unemployment supplemental. By eliminating both the supplemental for the unemployed and the self-employed, that's potentially taking as much as $150 million out of the state economy. And looking at the Bureau of Labor Statistics and Workforce West Virginia numbers, we're seeing West Virginians going back to work by the thousands each month. Could the businesses that are unable to fill vacancies, could it be that they're simply not offering competitive wages and benefits, and that may be the reason they're have jobs that are going unfilled?
Well, Phil, I understand completely what you're saying and everything, but I would just say one thing: wages trump unemployment dollars. That's all there's to it. Wages are what this is all about. And so at the end of the day, we want people working, and we're at 5.8%, and I'd love to see it significantly lower than that. But the bottom line, the whole thing is just one thing: is our small businesses are crying for people to come back to work, and we got a bunch of people that are still on the sidelines. We got to get them in the game.
All right, thanks, Governor. Back to you.
I think I don't have hardly anything other than just this. We kind of focused on General Hoyer and celebrating his 118th, and we were very proud of him and for making it that long. And we talked about Jordan and celebrating Jordan's birthday. We touched on Ann Erling and Mary Lippard, and because those great people. Ann's the chief of staff, deputy chief of staff, and Mary handles the money. I mean, for crying out loud, there can't be anybody more important than Mary handling the money. And so with that all said, they work here. They work really, really hard. And I know they're not on the front lines in these briefings, but we wish them all four of them. And if we forgot somebody, shame on us. But, we wish them all a really happy birthday. And we really, really appreciate all that they do each and every day. I mean, they're superstars, and this engine runs on a lot of good people, and I'm really proud of all of them. So thank you so much, and happy birthday, everybody.